signal you when like 2 minutes left. So.
Right. Go? I can go. I see it. So our practice focuses quite a bit on what we refer to as kind of mission-driven clients. And in particular, what I want to spend 10 minutes talking about is really the evolution of the academic medical center. And when we really have thought about how it's evolved from really 3 silos, or 3 legs of a stool, it's really evolved rapidly into very connected elements, elements that inform each other, elements that are very interdisciplinary, and elements that are ultimately highly collaborative. And that's something we're very interested in because our practice is really focused on the design and the program of clinical, medical education, and research facilities. So what I want to share with you in sort of a Pechacucha style is some trends that we're seeing in the work. So let's talk about life science research facilities. The big change that we've seen in academic research is really a move away from silos of research and a move towards what we call either multidisciplinary or interdisciplinary research, where teams of researchers are really focused on problems really between disciplines, by contrast to focus entirely within disciplines. And that's had a huge change in the kinds of buildings that we're designing. So when we think about interdisciplinary research, we really think sort of fundamentally that interdisciplinary labs are organized now around sort of 3 ideas. One is the lab itself, what we call the core facilities or the support elements, and most importantly in many cases the social fabric which really binds them together. And following on the previous comment by Tom, our evidence and our research suggests that what goes on outside the lab in terms of collaboration is equally important to that which goes on at the benchtop. We're realizing that interdisciplinary labs have to accommodate a range of disciplines that occur within the lab. So the labs have to be highly flexible to accommodate very dry activities to highly wet. And so we think of labs now as being very flexible and adaptable, and almost think of them like lofts. There's a series of terms that we use when we think about the design of modern research labs. The first is this idea of transparency and openness. That the core facilities are highly supportive. We think of them as interdisciplinary magnets, places where teams come together to do very specialized research. And the social fabric, which takes many sort of forms from meeting spaces to informal environments where people come together. And places in the design of corridors where people can stop and gather and exchange ideas. And this idea of fluidity, that research labs are no longer about a corridor system and a highly efficient layout, but it's about openness and connectedness, how people come together and how they interact. Now, interestingly, medical education has followed the same approach, which is that traditionally medical education was taught in silos. You go to an academic medical center, you see a school of pharmacy, a school of dentistry, a school of medicine. Well, the national trend now is towards what we call interprofessional education, teaching health science professionals as a team under one roof. And we're actually designing 2 facilities right now that really approach this idea of shared space, currently separate curriculum, but when accreditation changes, ultimately we see that being more of a shared curriculum. And so again, it's this idea of collaboration, interdisciplinarity amongst the health science professionals. So an example of that, this is our project at UVA, their new medical education building, and I think what's notable about it are some of the spaces we've designed. So this is a space that we've developed at UVA. It's called the Learning Studio, and the idea is to break out into teams of students, typically groups of 6, and instructors in the center. They lecture in the room, and they can deliver problems, and that material is being projected around the perimeter, and then teams of students actually work with a plasma screen. So they can move into sort of this team-based learning model and they can work together. And this has really kind of revolutionized the UVA curriculum. This is the space. This holds the entire class of 168 in one room, and it's been hugely successful for them. Again, a model of collaboration. The other forms of learning environments are ones called competency-based training, where you learn with patient actors or with simulators in advance of working with patients, almost like learning on a flight simulator. So this is what's called a standardized patient environment. Or human mannequins and simulators. So again, it's this model where teams can come together and they can practice in a real virtual environment in advance of working with patients. So what's going on in the clinical environment? And I want to spend a few minutes talking about our project in Palomar because we think it's really emblematic of really a change in healthcare delivery and this idea of creating collaborative interdisciplinary patient care environments. This project's under construction. It's going to be finished a little bit later this year. It's a 380-bed hospital. This idea of creating a hospital within a garden, a place of wellness with a deep connection to nature through green roofs and courtyards and skylights and balconies which extend up into the patient care environments. Now what I want to talk about are some of the patient care spaces. And on the second level is in the diagnostic and treatment block of the ORs. And this idea of interconnectedness. So we have what we call the integrated interventional platform. The idea is that you have a radiologist adjacent to a surgery suite. So you can move back and forth between these environments in the context of surgeries. The way we've designed that is that's an open loft. We've sort of taken the ideas of the lab and we've applied it into the clinical environment. So that's an unobstructed floor area. And what we've done is we've moved all of the services out into the perimeter. So that's a highly flexible space that can adapt over time and it's very unencumbered. And it also brings as much natural light into that environment as possible. The other piece that we're really quite interested in, and this was very much a client that was focused on the future of healthcare, is really in the patient beds area. This is a typical upper floor. And the concept of that floor is that it has 30 beds on one wing, which are traditional med-surg beds, and 24 beds, which are acuity adaptable. And the acuity adaptable bed concept is rather than moving the patient from room to room as they get better, you keep the patient in one place and you move the technologies out to serve them. And it's all based on evidence-based principles in the design of the unit. Now, what makes it interesting is that it has a deep effect on how nurses and healthcare providers work together. So again, it's this model of collaboration and team-based work. So for instance, in this model, there is no centralized nurse station. It's a distributed approach. So all of the nurses move out into the floor. They have workstations adjacent to each bed, and it's really decentralized storage. And so the belief is that this supports higher levels of patient care. Now, along with that is this idea of the acuity adaptable patient room. It's a slightly oversized room. It's zoned very carefully so that we have a patient zone, which is modeled in blue. We have what we call the family zone, and most healthcare designers know that the family plays a very important role in the health of the patient and their ability to move out of a hospital as quickly as possible. And the room has been oversized, so based on the technology, that can flex from med-surg all the way up to ICU. Here's an image of that room. It's been very carefully designed. It's an outboard toilet room. You can see that the rail so that the patient can move directly out of bed and directly into that bathroom. So we try to reduce the slip and fall problems. Directly opposite the bed is really a telecommunications piece where they have video information, they can work with their doctor, they can watch movies, they can order food. And then on each floor, this idea of nature, bringing nature up into the patient care floors, there's an atrium off of each of the levels. So this is really what you encounter when you step off the elevators at each level. So really, the underlying issue that I really started to speak of from the beginning is this idea of collaboration. And it's one that we're really seeing in all three environments, research, education, and clinical. And it's something we're very interested in, and it's a deep trend that we're seeing at the Academic Medical Center. Thank you.